Just introduce yourself.
Hi, I'm Mitul. I live in South London. I've had a jab, or a first dose in February. So I've had the first dose in February because with the UK or the English system of how they're giving out the vaccinations is they're doing it in age order, or they started in age order. I think it was December, and obviously the oldest people get it first, and then it went down to 90 plus, 80 plus, 70 plus, or 75 plus, and in the 75 plus group, which is group 4. I was included in that, even though I'm not over 75, because I'm extremely clinically vulnerable. I was put in that category because I had treatment for cancer in 2019. So I had a one-off dose of chemo in 2019, and then this all kicked off in March 2020. So since then, I've been getting letters from the NHS saying that I'm extremely clinically vulnerable, or I'm in that list anyway, and I should be being more careful in terms of the risk of catching COVID. And because of that, I was put into the group 4 to get the dose early, or to get the vaccine early. Just to clarify, I mean, obviously the NHS has put me in there because of the treatment I had, which was the one-off dose of chemo in August 2019, which put me into that list to get the vaccine early in February. So that's the first dose in February. I've got the second dose coming up in just over 2 weeks, coming up to the end of April.
Can you tell me about the process of having the vaccine?
As I said, being in that category, it was mid-February, or that they wanted to get that group 4 over 75s and extremely clinically vulnerable, have them offered the first dose by the middle of February. So it was on Saturday, the 6th of February, that I got a letter from the NHS. They gave me a link to book online for my first dose. It let me pick second dose date at the same time. So Saturday the 6th, I got a letter, I looked online. Next day, 5-minute walk down the road, the venue was anyway. So I booked it for the next day, which was Sunday the 7th. And then I booked the second one for the end of April. It was all pretty easy, doing it online. Took a couple of minutes and popped it on.
Could you talk about what it was like on the day?
So most people have said that when they've had their first doses, you go to the centre. Obviously, we've all seen it on TV in the news, where they've got large vaccination centres and they've got people queuing up in, obviously distanced. One of the things that people have been saying is that at the centres, they make you wait 15 minutes after the first dose, just to make sure there's no complications or reactions before they let you go. At the place that I got it, they didn't have the space for that. Basically, it was a very small opticians. The main bit of the opticians, it was quite small, and they had it separated by plastic screens, clear screens to separate everyone. Whilst we were waiting, went in, showed my letter, they scanned me in. I waited in my cubicle, and that was about a 20-minute wait, I think. Can't remember exactly when. It wasn't massively long, but it wasn't in and out. Went in to the side room, got the vaccine, and went out. And because there wasn't the space to wait, I literally went out. But they were saying that don't drive for the first 15 minutes, half an hour afterwards. I was like, it's a 5-minute walk, not an issue.
What vaccine did you have, and did you have any side effects?
Okay, so I had the AstraZeneca vaccine, first dose in February, and side effects wise, I didn't have not any major ones that other people have said, or even minor ones, because major ones are other, but minor ones being, being tired or whatever. I wasn't tired that I noticed. The only issue that I had, which is, you get them from the flu jab as well, which is when they did it, like it was like early afternoon, maybe in the evening, next day, for a few days, my arm ached a bit, but it wasn't much. It wasn't a massive amount to even need a painkiller. So for just leaning on it or sleeping on it or touching it would make it hurt a bit, but nothing, wasn't the end of the world.
With all the things in the news about the Oxford AstraZeneca vaccine, would you still encourage people to take it, and why?
Absolutely, yes. Obviously, we've had in the news lately now, we're coming up to, where are we? Today is the 17th of April. So in the last, 4 to 6 weeks, there's been news reports about people having blood clots and suffering blood clots, and a very few people dying from it. I can't recommend it enough. They've done the trials, which they did last year. They've been giving out this vaccine for 4 months now to the general public, and this is talking about millions of doses, like 20 million doses or whatever it is in the UK. And the number of people, obviously, anyone getting hurt or the blood clots or dying is, it's tragic. But the numbers are very small. And if you look into it from the news reports and from reliable sources, the risk of getting a blood clot is very small, and the risk of dying from the blood clot is very small. And especially when you consider other risk factors, there's a higher risk factor of getting a blood clot just by going into hospital for other treatment, from pregnancy, from birth control, and those risks are higher, significantly higher. We're not talking just like a small amount. We're talking, if this is the risk for the blood clot from the vaccine, this is the risk. You can see it. This is the risk in proportion, it's not mathematically accurate, but again, look at the numbers, it is massively different. So yeah, in terms of the benefits, weighing it up, whether it's the AstraZeneca vaccine or any other, just go out and get it. There's
Why did you personally get the vaccine, and why would you recommend other people get it?
So for the vaccine, it's a matter of protection for yourself and in principle not spreading it to others. Obviously, we're still wearing masks, we're still socially distancing at the moment, but overall, the vaccine programs, not just for this, but for other illnesses going back decades, it's there to protect ourselves, protect others. The main thing that we've had, obviously, in the last year, different countries have experienced different waves at different times. But the thing is, the health services in each country have, when they've had the week, peak waves, when they've had lots of hospital admissions of people being really sick, that's really caused loads of problems, even in the developed nations, as it were, where great healthcare systems, but with the numbers of people coming in, it's just, they were getting overwhelmed. And especially the staff, the doctors, nurses, all the medical staff, they were really facing it. So by getting the vaccine, it's found to really reduce the risk of getting seriously ill to a really small amount. So just by doing that, you're helping the healthcare system not get overwhelmed. And it helps those people that do get ill, even if they've had the vaccine, there's still a small risk of getting ill. Obviously, it's not 100%. They'll be better cared for in hospital because it's not overwhelmed.
So why did you have the vaccine, and why would you recommend that other people have the vaccine?
Obviously, within the UK, the numbers have been going down since the wave that we've had over the winter. One, because we've had a lockdown since just before Christmas. So that really helped to bring the numbers down, January, February, March, and now we're into April. So the numbers of infections have been going down a lot, and subsequent deaths have also been going down a lot, which has helped the healthcare system. And we've just come out of we've just had a big step in the lockdown easing, in terms of, before it was only just like food shops, essential shops, and like pharmacies and things that were open. Non-essential services weren't open. But this week they have opened up pretty much everything in terms of shops and businesses, so people can go, and go out, as it were, and do a bit more shopping, like clothes shopping and everything like that. The thing is, you can't go into a restaurant and eat inside the restaurant. If they have outdoor seating, that's nice. You can sit outside and get served outside. But again, that social distancing and not being in groups that were too big doors is still in place. In May, hopefully, with the numbers still able to go out a bit more and into bigger groups, and then the following step after that is June, where we'll be able to open up freely and mix freely. But again, this is all based on people taking the vaccine, still adhering to social distancing as required, wearing masks indoors, trying to limit what we can do in terms of spreading the infection, because it's not yet. So we need to try and do everything we can to make sure it doesn't spread more. And even with variants in the virus, we don't know what's going to happen. There is the idea that every year, maybe in the autumn or winter, a lot of people will have to get booster vaccines. Maybe not the younger generation, we don't know yet. But it could be an ongoing thing, like the flu now, where we have it every year. The vulnerable and elderly get flu vaccinations, and it helps keep the numbers of major illnesses and deaths down. It could be what we'll be facing with this.
Thank you for agreeing to be interviewed.
No worries, you're welcome. Happy to help anytime.